I was going to transition, but I'm not going to make the joke because there is no joking here. This is a very serious matter because strokes are on the rise for younger people. And the big question is, why is this happening? So Cleveland Clinic neurologist Dr. Jonathan Solomonow is joining us with a lot of really good, useful information. First of all, thank you for coming in.
Thank you for having me.
Second of all, I think that I know a good friend of mine in her 40s just suffered a stroke. Is it becoming more and more prevalent, or are we just making it's just more and more we're becoming aware of the fact that younger people are having strokes?
Yeah, that's such an important question because we've actually seen the overall rate of stroke decreasing, but younger and younger patients are having strokes. Ultimately this is coming down to lifestyle. We're seeing people lead more sedentary lifestyles. They're eating less healthy, they're less active. And at the same time, we're seeing increased rates of things like obesity and substance use. In addition, sometimes young people feel invincible. They don't follow up regularly with healthcare providers and might have undiagnosed conditions like high blood pressure, high cholesterol that often go unnoticed until something more serious like a stroke occurs.
I'm glad you said that because I feel like it's so important. I know so many people my age and younger who don't at least get an annual checkup even because they feel like, I feel good, I don't need it.
Right.
I mean, that's got to be one of the first crucial steps that you always are taking.
Absolutely, yeah. I can't tell you how many times we've had patients come in, unfortunately, and stroke is kind of that wake-up call that there's been all these underlying conditions brewing, and this is really the first time it's rearing its head.
So I know there's the whole be fast that we go through as a process where what you need to be doing or looking for when someone's having a stroke, the signs. Is it similar in younger folks as it is to those in the older population?
Yeah, great question. Age doesn't really play a role in kind of the symptoms. So, it doesn't discriminate by age, and everyone needs to be aware of these symptoms regardless of age. So we often teach our patients the BFAST acronym. So B stands for sudden changes in balance or dizziness. E is for eyes, so sudden vision loss or double vision. F is for facial droop. A is for arm numbness or weakness that affects one side of the body. S is for speech, so slurred speech or difficulty speaking or understanding. And T is for time to call 911.
Would those all be happening, or could you just have one or two of those symptoms and be suffering from a stroke?
Yeah, even one of these symptoms is incredibly concerning and should be a call to seek medical help.
So what if I always think of, if you're alone and you feel the symptom come on, you have probably minimal time to get a phone call to 911 or someone else. But what should someone do if they're alone and they start feeling these?
Right, you definitely want to call 911. I'd much rather you come in and we tell you it's a false alarm than miss the opportunity to treat a stroke. Even a few hours can be the difference between full recovery and lifelong disability. And as neurologists, our motto is almost time is brain and every second counts, meaning that every second that goes by, millions of brain cells are actually at risk for injury.
So, and there's probably not much we can do in that moment to help other than get them the medical help that they need quickly, right?
Absolutely.
Is there something that we can do to step in temporarily?
Not really. Don't delay. If there's any concern, call 911 or seek medical help.
And again, just thinking about the fact that so many younger people are going through this and the need to just stay on top of your health, what can we be doing to prevent this from happening?
Yeah, so the first part of that, like we were discussing, is making sure that you have regularly scheduled health checkups. A lot of the time, stroke is due to these preventable risk factors, either in the young or in adults. It's all the same. Things like high blood pressure, high cholesterol, diabetes, obesity, and smoking are things that we want to be on top of. And then the American Heart Association also recommends, 3 to 5 days a week of moderate exercise, as well as a healthy, balanced diet, like the Mediterranean diet that focuses on leafy greens, poultry and fish, and staying away from things like red meat and pork.
And again, you hear these things often for different things. It's good for our heart health, too, to be doing these things, too.
Absolutely.
So overall, I do feel like younger generations are being more health conscious about certain things, the way they eat, but I do think they sometimes lack in going to just get the regular checkups to make sure that they're good.
Absolutely. We sometimes refer to hypertension or high blood pressure as the silent killer. People think that they might expect signs like a headache or just feeling off, but oftentimes these things are completely asymptomatic, and you might be walking around your normal day and have no signs that something serious is going on.
Well, it is critical to get help fast in a situation like this. And if someone is having concerns and they're not in a situation like that where they need to be looking at Be Fast, are there other subtle signs that would creep into play, or maybe we could say, okay, they might eventually have a stroke or could have a stroke, or do those not necessarily present themselves?
Yeah, there could be more subtle signs, if you're having the worst headache of your life, or, one side of your body is doing something that the other side is not. Even if you're unsure, it's better to get that checked out than not.
Well, and you can always see the neurologist there at the Cleveland Clinic, that is for sure, Dr. Solomonow.
Yes.
Thank you so much for being in here today.
Absolutely.
And
thank
for
you.
giving us all of that great feedback.
Appreciate
Okay, when
it.
we come back, we are exploring a brand new summer menu at a favorite Flats location. So stick around. More New Day is coming your way.